Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. We've been talking about infertility, and on our last video, we talked about the female aspect in terms of the quantity and quality of the eggs. Today, we're going to talk about the male aspect of infertility and how do we go ahead and analyze if there's issues with the male in terms of the infertility process, right? So when we look at this, clinical evaluation of the male infertility patient, right? First, you got to do a semen analysis. In the semen analysis, what do we look for? We're looking for abnormal sperm morphology. Basically, does it look like a normal sperm that can swim and move around normally, right? And then you look at leukocyte concentration. Leukocyte basically means white blood cell. Is there white blood cells or leukocytes within the sperm content, right? If there is, it could indicate, one, the patient might actually have an infection or an inflammatory process going on, which is creating white blood cells in the semen concentration, okay? Low sperm count is a factor. Abnormal sperm motility. Can the sperm move at a normal rate to get to where it needs to get to? Basically, that's what it means, right? They can do this test in a regular LabCorp request. Bacterial concentration. Is there bacteria floating around in there, which can also indicate infection? So it's important to understand there's testing available, which is really simple to do, right? And to look at the quality or the strength of the sperm to get to where it needs to get to. Is there an infection, right? So it's important to understand those types of things. After the sperm analysis or semen analysis, you can do things like ultrasound, MRI. You can also look for sperm antibodies. Is the patient making antibodies to their own sperm or semen, right? Serum chromosomal testing to see if there's genetic variants. Much like in women, you can also do genetic testing. And then vascular studies. Poor blood flow, things like diabetes, right? Anemias, things that prevent blood flow to get to where it needs to get to is problematic in the production of sperm. So you can do vascular studies, serum chromosomal testing, sperm antibodies, ultrasound MRIs, and then a semen analysis to look at motility, bacteria, white blood cells, etc. So it's important to analyze not just the female component of infertility, but also the male component of infertility, okay? So it's important to understand this, and there are simple tests that you can do to start out with, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.